What's going on, everyone? Welcome to today's pandemic update for Friday, April 21st, 2023. We actually have no new COVID positives to report on today, and I have not found any new COVID outbreaks today. But let's start off with India, like we have been doing recently, as most of the world is watching India right now to see what happens with the XBB.1.16 variant. And speaking of the XBB.1.16 variant, some channel news. The XBB.1.16 variant update video, I usually do that Fridays, sometimes on Saturdays. If you're looking for that, this week it is going to be on Saturday. I'll probably do it tomorrow morning, get it out nice and early, maybe about 10 o'clock Eastern time tomorrow, something like that. But yeah, let's get to today's update, shall we? Today, India records another 11,692 cases. That is slightly lower than yesterday's number, which was over 12,000. And they did add another 28 deaths. So, and it does say here, Center asks 8 states to maintain strict vigil. In other words, keep a close eye, make sure people are taking the proper precautions. I wish they would use wording like that here in the United States. We can't even get wording like that. All right, this, I believe, is out in California. Kaiser Santa Rosa reintroduces masking requirements after hospital COVID-19 outbreak. Kaiser Santa Rosa has reintroduced masking requirements in its hospital and emergency room due to a recent COVID-19 outbreak. It is also recommending that patients use masks when visiting any of its 6 medical offices in the area. They say that more than a dozen of its 3,500 staff members, along with some patients, have tested positive for COVID-19. So this is concerning, and we've been seeing the XBB.1.1.6 variant rise a little faster in the West Coast, and you'll see that tomorrow in the Variant Proportion update. Taking a look here at this, Lightfoot's city employee COVID-19 vaccine mandate, this is for Chicago. Lori Lightfoot is the mayor of Chicago, overturned by Illinois' Labor Relations Board. So in other words, what they're saying is the mandate where you have to be vaccinated in order to be employed in Chicago by their local government officials. Yeah, you can now work for the city if you're not vaccinated. It's been overruled, so I'm assuming they are going to drop that. All right, taking a look at this day in COVID history. On April 21st, back in 2021, more than 200 million COVID-19 vaccine doses have been administered in the United States. And we all know what happened next. It slowed down pretty significantly, as there were a lot of people that did not want the vaccine, unfortunately. April 21st, 2022, the Department of Homeland Security, DHS, extends the COVID-19 vaccine requirement for all non-citizens entering the U.S., in addition to the requirement that all travelers show a negative antigen test taken within 1 day of departure. And again, like I said, we're losing a lot of the restrictions that were in place. I think this is one that is no longer in existence. If it still is, someone correct me, but as far as we all know, there's hardly anything left in terms of safety protocols and restrictions out there by the government. All right, taking a look now at the latest wastewater map, and you will see here there are some slight changes on the wastewater map, some that are rather confusing. If you notice here, the number says 117 new sites. Then you come to New York State, and you can see all the sites that we're reporting are, well, where did they go? They're gone. But then you have all these new sites that are on the map, so I'm not really understanding that. We still have the New York City sites showing, so that's interesting. If they don't fix this, we may not do a wastewater update dedicated video this weekend. We'll see. We may on Sunday anyhow. We'll just throw a bunch of counties together. And taking a look here at Ohio and the Great Lakes, it's still the moderate transmission sites. Then you come down here to Missouri. They're not reporting on wastewater anymore. I don't know what their deal is. And the West Coast is still just a mix. And we'll be watching to see if the West Coast starts rising soon because of the XBB.1.16 variant. Taking a look here at the CDC transmission map. Someone brought something to my attention yesterday. He said, if you don't test for COVID, the levels will not be high. That's actually correct. If we don't do enough testing, it's not going to show up on this map that there's much transmission. Or if majority of the tests are the at-home test, it does greatly screw up this map. And you're going to see a couple things interesting. First off, let's go through the numbers. 671 counties are in high transmission. 468 counties are in substantial transmission. 1,393 are in moderate. And 591 are in low. 18.34% of the counties are in low transmission. That actually increased by 5.12%. But you see something here. Look at Pennsylvania, and then come down here and look at Arkansas. Look at all the low transmission counties. Pennsylvania, I know for a fact, from the beginning of the pandemic, has had a huge problem with testing. There have not been enough people getting PCR testing during the entire pandemic in Pennsylvania. And I can only imagine it is far, far worse now. And because of that, this is a misinterpretation of probably what's happening here in Pennsylvania. Though the state keeps reporting that the levels are dropping, which I get it, they probably are dropping, but I doubt they're as low as our state is reporting. Arkansas, I don't know too much about their testing situation there. If anyone does, please tell me down below. They're another state that is having particularly a large number of counties that are in low transmission. And as we all know, Iowa is just not reporting at all. Iowa stopped all reporting, therefore the map comes up gray. Alright, moving on to this week's variant proportion. And we're just going to go through the national level. Like I said, tomorrow we will have the full variant proportion update. XBB.1.5, 73.6%. XBB.1.16 is up to 9.6%. And it didn't rise a whole lot this week. It rose over last week, but it wasn't a massive increase. It didn't go over 10%. I thought we would have seen it go over 10% this week. So I guess that's a good thing. XBB.1.91, 7.9%. XBB.1.92, 2.9%. XBB.1.51 is at 2.2%. FD.2 has not budged much. It's at 1.6%. And XBB is at 1%. Alright, taking a look at the great state of New Jersey. 200 new cases were added in the last 24 hours. 97 of them were probable cases. 2 lab confirmed deaths. And 6 hospital reported deaths. So, I guess if those are total deaths, if you combine the two numbers, that would make 8. Not certain how they do that. Taking a look at the hospitalizations here, 303 people in hospital, 15 people on a ventilator. Taking a look in central Pennsylvania, in particularly Center County, Pennsylvania, they increased by 1 hospitalization today to 6 hospitalizations. New York State, 677 people tested positive in the last 24 hours. That does not include at-home tests. That does not include reinfections. The positivity rate is higher today at 2%. The 7-day average is at 1.5%. Taking a look at hospitalizations in New York State, 753 people hospitalized and 83 people in the ICU. And let's take a look at New York City, because why not? New York City is ever so slightly higher than yesterday. 224 people in the hospital, 29 people in the ICU. Taking a look at the latest update from B&O. New cases reported yesterday. This is from yesterday. 33,431 new cases. Average is 13,930. That's down by 24. States reporting 24 out of 50. In the hospital, 15,428. That only dropped by 95, so that's not really a big drop. In the ICU, 2,021. That only dropped by 6. That's not a big drop. New deaths, 389. The average is flat at 192. And there was no other special information from B&O today. Nothing on H5N1 or anything like that. Taking a look at the Texas update for this week, 5,769 new cases reported on the Wednesday update. Probable cases, 4,475. Positivity is at 8.06%, and they added 61 deaths with an average of 9 deaths per day, 1,053 people in the hospital. Alright, let's take a look at some international data here. South Korea, 16% increase in cases, 23% decrease in deaths. India, only a 39% increase in cases now, 60% increase in deaths. We'll have to watch if that keeps dropping. I suspect at some point, maybe either Sunday or Monday, we will see a couple days where cases are lower, just simply because of weekend lag, and then by the end of next week, they'll be back higher again. Will they go higher than what we saw this week? That we'll have to wait and see. Japan, 9% increase in cases, 14% decrease in deaths. USA, United States, our country, only a 20% decrease in cases now. So while it is still decreasing, it's not decreasing as fast. Deaths down 31% in the United States. France, look at this. 4% increase in cases, but 185% increase in deaths. The last 7 days adds 248 deaths versus just 87. Russia, 12% decrease in cases, 1% decrease in deaths. Australia, cases are up 4%, deaths are down 3%. Italy, cases up 29%, and deaths are up 48%. Greece, cases are up 36%, deaths are down 34%. Mexico, 117% increase in cases now, and 102% increase in deaths, so that's relatively concerning. Germany, cases up 5%, deaths up 10%. Spain, cases now up 42%, so that number is continuing to rise, as is the death number, which is up 18%. Vietnam, cases are up 625%, no reports on deaths there. Indonesia, cases up 46%, deaths up 33%. Austria, cases down 9%, deaths down 19%, and we'll just end it on Malaysia, where cases are up 13% and deaths are down 50%. All right, we are entering another weekend. You have made it through another week in this pandemic. However, now you need to make it through a weekend in pandemic. And weekends often, revolve around risky behavior. Maybe you have to go to a gathering. Maybe you have to go to an event. Maybe, God forbid, you are deciding to go to a function where it's going to be crowded inside, or you're going to do outdoor dining or something somewhere. Please, be careful with your behavior over this weekend, because I want to see you all again next time. I want to see you all viewing my video next time, and until I see you again next time, I want you to do so being negative. I want you to stay safe, and second of all, I want you to hit the like button down below if you like this content. If you don't, that's fine too. It's your prerogative. And if you want to see more content like this, subscribe to my channel. So I will see you all again next time, and I will see you safely again next time, which will be back here again tomorrow morning for the Variant Proportion Update, followed by tomorrow's Pandemic Update. Thanks for watching. Have a great and safe weekend, everyone.